Every year, for thousands of Nigerians diagnosed with cancer, the journey often begins late, sometimes too late. Across Nigeria, cancer patients grapple with delayed diagnosis, limited access to specialist care, and high cost of treatment, factors attributed to fueling deaths. According to data from the World Health Organization, as of 2023, Nigeria recorded over 127,000 new cancer cases and 79,542 cancer-related deaths, with a 5-year prevalence of 269,109 cases. Breast, prostate, cervical and colorectal cancers are the most prevalent in Nigeria, with breast cancer being the leading cause of death amongst women. Incidence is higher in women, with roughly 88 women diagnosed daily. For years, Nigeria's oncology services have been overstretched, with few radiotherapy machines, limited diagnostic equipment and a shortage of trained oncologists. As of 2025, there are approximately 27 cancer treatment centers in Nigeria, catering to a population of over 200 million people. In response, the federal government is scaling up early detection and strengthening cancer care infrastructure nationwide. The federal government is expanding with 3 new major specialized cancer centers commissioned in Enugu, Katsina, and Edo states in July 2025. The government is actively upgrading infrastructure, including 6 federal tertiary hospitals in Zaria, Enugu, Lagos, Katsina, Jos, and Benin, with advanced modern equipment to reduce the need for overseas treatment. Recently, in celebration of the 2026 World Cancer Day, the federal government unveiled 2 landmark policy documents: the National Nuclear Medicine Policy and Strategic Plan, the first of its kind in Nigeria, and the National Cancer Control Plan 2026 to 2030. Aimed at strengthening cancer prevention, early detection, diagnosis, and treatment. The government also announced plans to establish 8 preventive oncology clinics in federal tertiary health institutions across the country, enabling Nigerians to access routine cancer screening services. There is also a plan to integrate cancer screening and treatment across all primary healthcare centers of the Federation to serve the grassroots and enhance early detection. Furthermore, the government is building on the success of previous interventions to improve treatment access for cancer patients, with the signing of 2 agreements with the International Finance Corporation and other partners worth $24 million. The aim is to improve cancer care and deliver transformational health infrastructure across Nigeria.
There's a whole value chain upstream as well as downstream that can be unlocked so that the jobs and the economic growth can happen. I'm bringing all that together to say that this is a moment that we are celebrating because of the hard work, the quality of people that we have.
The quality that brought to bear, is it 3 or 4 oncology centers? 3 of them I have been to, the commissioning, and is now expanding and building on. Is that momentum that President Bola Ahmed Tinubu is putting in place for the economy broadly.
The Cancer Health Fund was created to cushion the cost of cancer care for vulnerable Nigerians. However, poor funding has limited its impact. In the 2025 budget, the federal government proposed a total of 200 million naira for the Cancer Health Fund, 150 million for the National Cancer Health Fund, and 50 million naira for the Childhood Cancer Health Fund. However, in the 2.48 trillion naira allocated to the health sector in the 2026 budget, there is no disclosure of the fund for cancer care and treatment. Health advocates, including the Nigeria Cancer Society, have repeatedly pointed out that the current allocation in 2025 is far below what is needed for effective nationwide care and support.
The minimum that's accepted to us is 1 billion. the 150 million should be, upgraded to 1 billion. With 1 billion, another 1 billion will even solve the problem. It will just scratch the problem.
As Nigeria pushes for earlier diagnosis and stronger oncology services, the hope is that cancer would no longer be a death sentence, but a disease detected early and treated effectively. From Abuja, Victoria Long John, Channels Television News.